Hi friends, welcome back to Complete Medical Coding, a complete CPC learning channel. Today, let's move on to the 40,000 series, that is the guidelines of digestive system. Let's look into it. So, let's move on to the digestive system. These are the 40,000 series and it ranges from 40,490 to 49999. Before moving to the guidelines, let's discuss some medical terminologies. What do you mean by kiloplasty? Kiloplasty means repair of lip. Vermilionectomy means lip shave or visible lower red lip will be removed. Ectomy means removal. So visible lower red lip will be removed. Gingivectomy, operculectomy, all these are related to the mouth. Gingivectomy, excision of gingiva, means cutting few parts of gums. Operculectomy, excision of pericoronal tissues. This means flap of gum over the wisdom tooth is cut away. Vestibule of mouth, it's important. What do you mean by vestibule of mouth? You can expect this question in an anatomical session. Part of the oral cavity outside the dentoalveolar structures. It means it includes mucosal and submucosal tissue of lips and cheeks. What is EGD? Esophagogastroduodenoscopy. ERCP, endoscopic retrograde cholangiopancreatography. So these are few medical terminologies. We'll be discussing in detail about EGD and ERCP. Let's move on to EGD, esophagogastroduodenoscopy. It means examination of esophagus from the cricopharyngeus muscle, means upper esophageal sphincter muscle, and including gastroesophageal junction, including examination of the proximal region of the stomach. To report esophagogastroscopy when the duodenum is not examined or because the clinical situation precludes safe exam of duodenum, we need to append modifier 52 if repeat examination is not planned. So during the process of esophagogastroscopy, this is esophagogastroscopy, okay? When the duodenum is not examined or due to some circumstances, they cannot proceed, the physician cannot proceed until the duodenum, we need to append modifier 52 if the repeat examination is not planned. But if the repeat examination is planned, we need to use the modifier 53. What do you mean by modifier 53? Discontinued service. 52 reduced service. 52 is the reduced service, okay? Esophagoscopy guidelines. There are few esophagoscopy guidelines that you need to remember while coding for esophagoscopy. Approach, equipment and purpose. Approach can be transoral or transnasal. Equipment can be rigid or flexible. And purpose can be diagnostic or therapeutic. Next is an important session, ERCP, endoscopic retrograde cholangiopancreatography. These are therapeutic ERCP codes that ranges from 43261 to 43278. So therapeutic ERCP codes always includes diagnostic ERCP code, which is the diagnostic ERCP code 43260. That is a diagnostic ERCP code. ERCP includes guide wire passage when performed. ERCP is considered complete if one or more of the ductal systems is visualized. Which are the ductal systems? Pancreatic or biliary. That's mentioned below. Which are the ductal systems? Pancreas, which includes major and minor ducts. Biliary tree. Which are the ducts of biliary tree? Common bile duct, right hepatic duct, left hepatic duct, cystic duct or gallbladder. So these are the ductal systems, two main ductal systems, pancreas and biliary duct, that you will be getting it repeatedly in this session. Next, codes that ranges from 4327 4 to 43277 describe ERCP with a stent placement, removal or replacement and balloon dilation within the pancreatic biliary system. Okay, these are just the code ranges that are that describes the stent placement, removal or replacement. When we discuss practice questions, you will be getting more idea about all this. ERCP with the stent placement includes any balloon dilation performed in that duct. So if it is with the stent replacement, it means balloon dilation is also included. ERCP with more than one stent placement, for example, it can be different ducts or side by side in the same duct. Performed during the same day or session, we need to report it with the CPT code 43274 for more than once using the modifier 59. What is modifier 59? Distinct procedural service. Okay. So if it is more than one stent placement, that can be in the same duct or different ducts during the same day or session, you need to report the code 43274 with modifier 59. Then ERCP with more than one stent exchanged during the same day or session, we need to use the code 43276 for the initial stent exchange and use modifier 59 for the each additional stent exchange. If it is more than one stent exchanged, you need to use code 43276 with modifier 59. ERCP with the balloon dilation of more than one duct during the same day or session, you need to report with the code with modifier 59 to the subsequent procedure. If it is more than one duct, for the subsequent procedure, you need to add the modifier 59. Sphincteroplasty. What do you mean by sphincteroplasty? It means balloon dilation of the ampulla. What is ampulla? Sphincter of OD. Sphincter of OD is another term for ampulla. Okay. So balloon dilation of ampulla is called as sphincter of OD. It is reported with the 43277 and includes sphincterotomy 43262 when performed. For bilateral balloon dilation, if it is bilateral balloon dilation, use modifier 59 along with the code 43277. Okay, it may be reported twice with modifier 59. Twice because bilateral along with modifier 59. Then another guideline, stone destruction includes any stone removal in the same ductal system, biliary or pancreatic. It can be any ductal system, but stone destruction, it is already included the stone removal also. Destruction and removal both are included. Means it cannot be like destruction coding initially and then removal of the stone coding separately. It's not possible. Like that we cannot be reported. Now, code 43277 may be reported separately if sphincteroplasty or dilation of a ductal system is required before proceeding to remove stones from the duct. Do not report code 43277 for use of a balloon catheter to clear stones from a duct. So if there is a use of balloon catheter, then you need to you cannot code 43277 for a balloon catheter. Now, examination of the hepatobiliary system. It means which are the hepatobiliary system? Pancreatic ducts, hepatic ducts, common bile ducts, duodenal papilla. Another name is ampulla of Vater, duodenal papilla, ampulla of Vater, and gallbladder. These are the hepatic biliary system. So examination of this hepatobiliary system is performed through a side viewing flexible fiber optic endoscope. Okay. So let's move on to endoscopy now. Few medical terminologies. What do you mean by sigmoidoscopy? Examination of entire rectum, sigmoid colon, and a portion of the descending colon. That is called as sigmoidoscopy. What is proctosigmoidoscopy? Examination of rectum and a portion of sigmoid colon. Colonoscopy, examination of entire colon from rectum to cecum and may include terminal, ileum or small intestine. Now, when performing a diagnostic endoscopy procedure and the physician is unable to advance the colonoscope to cecum due to unforeseen circumstances, report the colonoscopy code using modifier 53. If a diagnostic endoscopy procedure, if the physician is performing a diagnostic endoscopy procedure and he cannot reach until the cecum, colonoscope to cecum due to some circumstances, then we need to report the colonoscopy using modifier 53. If it is a therapeutic colonoscopy is performed and does not reach the cecum, we need to report it with modifier 52. When bleeding occurs as a result of an endoscopic procedure, control of bleeding is not reported separately during the same operative session. So there is a colonoscopy decision tree. From the tree, you can identify it easy. See, this is the colonoscopy decision tree. From this, you can identify, like it's very easy to identify. Decision to undergo colonoscopy. Initially, the physician is deciding to undergo a colonoscopy. It can be a diagnostic procedure or a therapeutic procedure, right? If it is a diagnostic procedure and the physician does not reach splenic flexure, it means does not reach till the cecum. It will be flexible sigmoidoscopy. We will code this. We will code it as 45330. That will be the flexible sigmoidoscopy code. And if the physician reaches beyond splenic flexure but not to the cecum, then we need to use the colonoscopy code 45378 along with modifier 53. Then if the physician has reached to cecum, until cecum, we will not use any modifier. We will use only the colonoscopy code 45378. Now, if it is a therapeutic procedure and the physician does not reach splenic flexure, means until the spleen, flexible, you need to code flexible sigmoidoscopy code. It can ranges from 45331 to 45347. The other G code, just ignore it. We don't really require it. Now, if the physician reaches beyond splenic flexure but not to the cecum, you need to use same like diagnostic. You need to use the colonoscopy code. The code range is there 45379 to 45398 along with modifier 52. And if the physician has reached until cecum, use the colonoscopy code with no modifier. Next, let's discuss about liver transplantation. During all transplantation process, three things you need to keep in mind. If the donor is a living or cadaver donor, then backbench work and transplantation procedure, the recipient transplantation. Okay. So as an example, I'll just discuss only liver transplantation here. Like that, pancreatic transplantation and few were there. Okay. So liver transplantation involves three distinct components of physician work. Same like what I had told before, cadaver donor, the donor. It can be a living donor or cadaver donor. So if it is a cadaver donor hepatectomy, it includes harvesting of the graft and cold preservation of the graft. If it is a living donor hepatectomy, it includes harvesting the graft, cold preservation of the graft, and care of the donor. And then backbench work. The second one is backbench work. Standard preparation of the whole liver graft will include one of the following. Backbench work means it's a preparation of the whole liver graft. It includes any one from the below. It can be preparation of the whole liver graft. It can be preparation as described for whole liver graft plus trisegment split into two partial grafts. Then it can be preparation as described for the whole liver graft plus lobe, the liver lobe, right? Split into two partial grafts. Or additional reconstruction of the liver graft may include venous or arterial anastomosis. So these are the backbench work. Then third one, recipient liver allotransplantation, which includes recipient hepatectomy, transplantation of the allograft, and care of the recipient. Surgical laparoscopy always includes diagnostic laparoscopy. So it means we don't have to code separately for a diagnostic laparoscopy if the surgical laparoscopy is performed. Now, if you want to report a diagnostic laparoscopy only, which is also known as peritoneoscopy, we need to use the code 49320. Similar to that, surgical endoscopy always includes diagnostic endoscopy. Now, moving on to repair of hernia. In order to code for repair of hernia, you need to make sure these 5 things have to be remembered, like type of hernia, age, mesh, and the type of the initial or recurrent, if it is reducible or incarcerated. What are the types of hernia? Inguinal, femoral, incisional, and ventral. These are the types of hernia. And you need to check for the age if the age is less than 5 or greater than 5. And if the procedure is included with or without mesh, if it is an initial or recurrent, reducible or incarcerated. Another word for incarcerated is strangulated. Okay. All codes are included with mesh only. All the procedure codes, they are included with mesh. It's by default, it will be with mesh. So friends, that's all about the guidelines of digestive system and a few practice questions about the digestive system. We will be discussing it in the upcoming sessions. So hope you like the video. If you are new to the channel, please subscribe to my channel and please support me. Thank you so much. Let's see you in the next episode. Bye.